Did you know that in the United States, someone has a heart attack every 40 seconds? Did you also know that every minute counts during a heart attack? Every minute you wait for help, your chances of survival decrease by 10%. Surviving a heart attack alone is a crucial skill, especially considering the statistics. Heart attacks are one of the leading causes of death worldwide, and it's not uncommon for people to be alone when they occur. We've all heard the phrase, time is of the essence. And it's especially true in this situation. The knowledge and skills to respond in an emergency can be a lifesaver. When you're alone and experiencing the symptoms of a heart attack, every second counts. If you're not prepared, you might not get the help you need in time. It's scary, but it's a reality many people face daily. That's why it's essential to know what to do if you're having a heart attack and there's no one else around. Imagine being in a situation where every minute feels like an eternity. You're in pain, you're scared, and you're not sure what to do. That's a terrifying thought, but it's exactly what happens when people are alone during a heart attack. Heart attacks are a significant health concern, and they can affect anyone regardless of age, gender, or fitness level. It's essential to take the necessary steps to prevent them, but it's also crucial to know what to do if you have one. The statistics are staggering. In the United States alone, someone has a heart attack every 40 seconds. That's over 2,100 heart attacks per day, and many of those people will be alone when it happens. Heart attacks are often unexpected, and they can happen anywhere, at home, at work, or even while exercising. It's a myth that heart attacks only happen to older people or those who are out of shape. The truth is, anyone can have a heart attack, and it's always better to be prepared. So, what can you do if you're alone and having a heart attack? The good news is that you can increase your chances of survival with the proper knowledge and skills. It's not just about calling 911 and waiting for help to arrive. There are many things you can do to help yourself until the paramedics arrive. We will also share preventive measures with you to reduce your risk of a heart attack. But with the proper knowledge and preparation, you can reduce your risk of complications and even death. So what is a heart attack? A heart attack occurs when an artery that supplies blood and oxygen to the heart becomes blocked. Fatty, cholesterol-containing deposits accumulate over time, producing plaques in the heart's arteries. If a plaque ruptures, a blood clot can form, blocking the arteries. This blockage prevents oxygen from reaching the heart muscle, causing damage and potential tissue death. Before we get started with our 12 crucial tips for surviving a heart attack alone, we would love to know where you are watching from. You will need to watch this video to find one tip that stands out. These tips are designed to help you stay calm, get help, and increase your chances of survival. Number 1. Recognize the symptoms. Don't ignore these typical heart attack warning signs. In no particular order. First, chest pain or discomfort. Imagine your heart is a house that needs constant food, which is blood, to keep working. A heart attack happens when something blocks blood flow to your heart, like when a pipe gets clogged and water can't flow through it. Now imagine your body is trying to tell you that the house isn't getting enough food. It might say, ouch, my chest feels like someone is squeezing it hard, or, it feels like something heavy is sitting on my chest and I can't breathe. Maybe it feels like your chest is so tight it will burst, or it just hurts badly. This pain might last for a while or come and go, but even if it goes away, it's still a warning sign that something might be wrong with the pipes that feed your heart. It's like being in the house and suddenly hearing a loud banging in the pipes or the water stops running. You know something is wrong, right? That's what chest pain is like for your heart. It's a signal that something is wrong and you need to get help. Second, pain or discomfort in other areas of the upper body. This can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. It's like your body is telling you that your heart needs help, even if it doesn't use words. Third, shortness of breath. Have you ever run fast and felt like you couldn't catch your breath? That's kind of what it can feel like during a heart attack, even if you haven't been running. Your heart needs a constant flow of blood to work properly. It's like your heart needs to take a breath every second. A heart attack happens when something blocks that flow, and your heart can't breathe as well as it should. So if you suddenly feel like you can't catch your breath, it could be a sign that your heart needs help. This can happen even if you don't have any chest pain. It's like your body is saying, hey, my heart can't breathe, I need help. If this happens, don't ignore it. Get help right away. The sooner you get help, the better. Other signs. These may include breaking out in a cold sweat, nausea, or lightheadedness. You know how your stomach feels funny when you're about to throw up? or how you feel dizzy when you spin around too much. Sometimes those same feelings can be a sign that your heart needs help. Your heart is like a pump that sends blood all over your body. A heart attack happens when something blocks that blood flow and your heart can't get what it needs to keep working. When that happens, your body might try to warn you. It might give you chest pain, but also make you feel sick to your stomach, dizzy or lightheaded, or even sweaty, even if it's not hot outside. These are all ways your body tries to say, "Hey, something's wrong with my heart. I need help." So, if you feel any of these things, getting help right away is important. Don't wait to see if it gets better. The sooner you get help, the better. Number 2, call 911 or your local emergency number immediately. The faster you get help, the better your chances of survival. Don't hesitate. Even if you're unsure if it's a heart attack, describe your symptoms clearly and calmly to the operator. Number 3, stay calm. A heart attack is a bit like someone messing with the drummer's drums, making it hard for them to keep a steady beat. This can make you feel scared or panicked, which is like telling the drummer to play even faster. But that just worsens things because your heart needs to stay calm and steady to do its job. So even though it's scary, it's essential to try and stay calm during a heart attack. It's like taking a deep breath and saying to the drummer, "It's okay, we're going to get through this together." Taking deep breaths can help your heart slow down and find its rhythm again. Think of it like this. If you see a friend who's scared or upset, you wouldn't yell at them or make them even more anxious, right? You'd try to calm them down and help them relax. That's what you need to do for your heart during a heart attack. Number 4, chew an aspirin. Aspirin helps prevent blood clotting. Chew a 325 milligram tablet, non-enteric coated, while waiting for help. Importantly, only do this if you are not allergic to aspirin and have no history of bleeding disorders. Number 5, unlock your door. If you are at home, unlock your door to make it easier for the paramedics to enter, or your family, friends, or neighbors to come in and stay with you while waiting for the paramedics to arrive. Number 6, stay on the phone. If you've called 911, stay on the phone with the operator as long as possible. They can provide valuable instructions and keep you calm until help arrives. Number 7, cough repeatedly. Coughing can help keep your blood flowing and may even help dislodge any blockages. In some cases, forceful coughing can help maintain blood flow to the heart. However, only do this if advised by a medical professional on the phone. Number 8, take slow, shallow breaths. When your heart struggles to breathe, you can help it by taking slow and shallow breaths yourself. It's like you're showing your heart how to calm down and find a steadier rhythm. This can help your heart slow down and work more efficiently, giving it a better chance to recover. Number 9, try to stay awake. It's essential to stay awake and alert until help arrives. If you start to feel sleepy or dizzy, try to fight it off. Number 10, stay put. Don't try to drive yourself to the hospital or move around too much. Just stay put and wait for help to arrive. Number 11, avoid food or drink. Do not consume anything except aspirin. Number 12, keep a list of medications. Have a readily available list of your medications, including dosages, to share with paramedics. This will help them provide the best possible care. One tip that really stands out is tip number 7, cough repeatedly. This might seem simple, but it can be a lifesaver. Coughing can help keep your blood flowing and may even help dislodge any blockages. It's easy to do, but it can make a huge difference. Prevention is key when it comes to reducing your risk of a heart attack. Here's a breakdown of critical preventive measures. 1. Lifestyle changes. Smoking dramatically increases your risk of heart disease because it damages blood vessels and increases blood clot formation. If you're a smoker, quitting is the absolute best gift you can give your heart. Resources like nicotine replacement therapy, counseling, and support groups can significantly improve your chances of success. Staying active is also crucial. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could include brisk walking, cycling, swimming, or dancing. If you prefer vigorous activity, aim for 75 minutes per week, consisting of running, height workouts, or competitive sports. Even incorporating small bouts of activity throughout your day, like taking the stairs instead of the elevator or parking farther away from your destination, contributes to a healthier heart. Your diet plays a vital role too. Focus on a heart. Healthy eating pattern filled with various colorful fruits and vegetables, whole grains like brown rice and quinoa, lean protein sources such as fish, poultry, beans, and lentils, and healthy fats found in avocados, nuts, and olive oil. Limit saturated fats found in red meat and full-fat dairy products. Trans fats often found in processed foods, cholesterol, sodium, aim for less than 2,300 milligrams per day, and added sugars found in sugary drinks and desserts. If you're overweight or obese, losing even a small amount of weight, even 5 to 10% of your current weight, can significantly reduce your risk by lowering blood pressure and cholesterol levels. Stress management is also essential. Chronic stress can contribute to high blood pressure and other heart-related problems. Find healthy ways to cope with stress, such as regular exercise, mindfulness practices like meditation, deep breathing exercises, or spending quality time with loved ones. And if you drink alcohol, do so in moderation. Up to 1 drink per day for women and up to 2 drinks per day for men. Excessive alcohol consumption can raise blood pressure and contribute to heart problems. Number 2, medical management. High blood pressure is a significant risk factor for heart attack, so work closely with your doctor to keep it within a healthy range, typically around 120/80 mmHg. This may involve lifestyle changes, medications like ACE inhibitors or diuretics, or both. Similarly, high cholesterol can contribute to plaque buildup in your arteries, increasing your risk. Your doctor can recommend lifestyle changes, medications like statins, or both to manage your cholesterol levels. Aim for healthy levels of LDL cholesterol, bad cholesterol, and HDL cholesterol, good cholesterol. If you have diabetes, keeping your blood sugar levels under control is crucial for protecting your heart. Work with your doctor to manage your diabetes through lifestyle changes, medication, or both. Keeping your A1C levels within the target range can significantly reduce your risk of heart complications. Number 3, regular checkups. Seeing your doctor for regular checkups is essential for identifying and managing any risk factors for heart disease. Your doctor can assess your overall health, check your blood pressure and cholesterol levels, and provide personalized guidance on reducing your risk. Be proactive about your health and know your numbers. Keep track of your blood pressure, cholesterol levels, and blood sugar, if applicable. 4, other important factors. Prioritize getting 7 to 9 hours of quality sleep each night. Sleep deprivation can negatively impact cardiovascular health by raising blood pressure and increasing inflammation. Establish a regular sleep schedule, create a relaxing bedtime routine, and make sure your sleep environment is conducive to restful sleep. Also, take steps to prevent infections, as they can increase your risk of heart problems. Practice good hygiene, such as washing your hands frequently. Stay up to date on recommended vaccinations, including the flu shot and pneumonia vaccine, and seek prompt treatment for any infections that arise. Remember that even small changes in your lifestyle can make a big difference in your heart health. It's never too late to start taking steps to prevent a heart attack. When you hear a fire alarm, you don't wait to see if there's a fire, right? You get out of the building. These heart attack warning signs are like your body's alarm system. When you notice them, please get help as soon as possible. What do you think of these tips for reducing your risk of a heart attack? Have you or someone you know ever had a heart attack? Let us know in the comments below. If you want to watch more health-related videos, subscribe to our channel and click on the notification bell. Thank you for watching.